Good morning, guys. This is your friendly neighbor pediatrician Dr. Aditya Bhatt, and today we'll discuss something about paroxysmal nocturnal hemoglobinuria. So, it is a rare clonal disorder for hematopoietic stem cells, and it is due to the mutation of PIGA gene. Due to PIGA gene encodes GPI anchored protein. So there is deficiency of CD50. There is abnormality of CD55 and 59. So CD55 is also called as decay accelerating factor, while CD59 is also called as membrane inhibitor of reactive lysis. So these two are protective of the RBC membrane, which are usually abnormal in this condition. So there is abnormal RBC lysis. So aggravating factors are usually what we see is acidosis, or when we sleep there is a sluggishness of the blood flow, so which exacerbates the hemolysis. And the other conditions are infections and vaccination. The most common vaccination causing this is streptococcus. Now, clinical feature usually present as hemoglobinuria, and as you know that hemoglobin is toxic to the kidney, so recurrent hemoglobinuria will cause kidney damage, chronic renal failure, and it also causes proximal renal tubular acidosis. Now, another feature of this condition is thrombosis. There is thrombosis is abnormal site, including IVC and portal veins, which might IVC thrombosis might manifest as edema of the lower limb, and there is also splenic vein thrombosis, planktonic vein thrombosis, and also CNS thrombosis. But it is always venous thrombosis. Now, the classification used to for this condition is also called as Wendell classification, and it is out of the scope of this lecture to discuss the entire classification. But I'll just read to you the headings of that. That is, first is aplastic anemia with detectable PNH cells. Second is aplastic anemia with PNH. Then third is PNH aplastic anemia. Fourth is classic PNH, and fifth is MDS PNH. Now, in what conditions would you suspect that the patient has PNH? Then the conditions include hemoglobinuria and Coombs negative DIC. Coombs negative hemolytic anemia. The other conditions where we see Coombs negative hemolytic anemia is Wilson's disease, where we'll discuss in some further lectures. Now, what are the investigations that you will do in such patients? Then the specific investigations that we do in these conditions are HAMS test. HAMS test is a specific but not a sensitive test, while there is a sucrose lysis test, which is more sensitive but less specific. Other investigations are GPI anchor based assays and aerolysin based assays. Now, the treatment for this condition is eculizumab. Eculizumab, you know, is a monoclonal antibody against C5, so it is also used in other conditions, and it is the second most expensive drug worldwide. Please comment down below what drug do you think is the most expensive throughout the world, and I'll try to reply. And other treatment that we can use are corticosteroids, androgens, folates, splenectomy, and management of thromboembolic disease. And the final corrective treatment is stem cell transplant. That's all for today. Thank you. Please like, share, and subscribe.